Hello, we can start.
Okay, let's start. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, ladies and gentlemen. Welcome back to Health Scientific Event. Before we start this event, let me introduce myself. I'm Nadiah Tsabitah, the moderator and MC today's Health Scientific Update event. I'm very pleased to see you here and welcome all of you to this event. Honorable Ms. Mia Srimurti, SGC MSE as the Dean of Architecture. Honorable Ms. Apotheker Ernie Halimatu Sadia M.Farm, Head of Pharmacy, UBinawan University, Study Program. Honorable Sir Aji Humaydi SSE M.Farm as PLT Head of Pharmacy Study Program, Health Science and Technology. Honorable Ms. Apotheker Puspita Sari M.Farm as the speakers at this afternoon event. Honorable Ms. Apt.Bunga Destiyana and Sis Dila Apriani as a team of panelists, and honorable to the team of lecturers from the Faculty of Health, Science and Technology. Don't forget to all participants in the Health Scientific Update will have attendance. In the 11th round of this activity broke the following topic: rational drug use role of pharmacists. I previously want to read a CV our speakers from Apotheker Puspita Sari M.Farm. Education, graduate from Universitas Pancasila, master degree in pharmacy, hospital pharmacy, Pancasila University, clinical or other experience, lecturer pharmacy study program, UBinawan University, Faculty of Health, Science and Technology, training and workshop on aseptic technique, dispensing sterile drugs and cytostatic, comparative study of General Hospital Singapore, comparative study of Hospital Thailand, comparative study of Malaysian National Hospital Malaysia, patient safety. Research experience 2016 to 2018 at the Hospital Pasarbo S Jakarta. In 2020, community service at UBinawan University S Jakarta. 2022 research on pharmacist employed turnover at SHLC. In 2022, a study to analyze the cost effectiveness of antiretrovirals, favipiravir. 2022 research on the use of antibiotic for the treatment of urinary tract infection in outpatient BPJS patient at Ciracas Hospital. National publication, evaluation of treatment profile, use of human insulin and analogs in BPJS diabetes type 2, patient in Pasarbo Hospital, increase body immunity with herbal plants in the midst of the COVID-19 pandemic, the effect of job satisfaction on turnover intention of pharmacists at X-Hospital in Bandung City, use of antibiotics for the treatment of urinary tract infection in outpatient BPJS patient at Ciracas Hospital. Professional organization, Tangerang Pharmacy Manager, member of IIE, name and position in workplace, Pusada Hospital, Head of Pharmacy Installation, Santosa Central Bandung Hospital, Head of Pharmacy Installation, Santosa Kopo Bandung Hospital, Head of Pharmacy Installation, Iksan Hospital, Head of Pharmacy Installation, Iksan Hospital, Medical Support Manager, UBinawan University as a lecturer, PT ITM Cosmetic Technical Consultant. Previously, did Ibu Dwi join with us? Halo Ibu Dwi.
Hello, okay, thank you very much, Nabila. We can start. Good afternoon, good afternoon. Welcome to the scientific update 11 season with Dwi Puspita Sari, apothecary Dwi Puspita Sari, about rational use drug of rational and irrational products. We can start right now. Can share screen?
Okay.
Okay, rational drug use of role of pharmacist. What should become pharmacist do with irrational drug in hospital for especially? Slide. What is definition of RGU, rational drug use, and then what's the factors of race RGU influencing use of medicine, and then type of the rational use, diagnosis, prescription, dispensing. This is usually pharmacists doing in the hospital. And then hazard of irrational use of drugs, role of pharmacists in RDU, and then method of development of RDU, drug use indicators, drugs and therapeutic commits, standard treatment guidelines, pharmacovigilance, and pharmaceutical care. Pharmaceutical care never always we can always remember what is the pharmaceutical care, so important in pharmacists, yeah. So don't forget about pharmaceutical care. And then slide. The rational use of drug require that patient receive medication appropriate to their clinical needs. So those to meet their own individual requirements, and then for an adequate period of time and lowest cost of them and their community. For explain that's medication so important about the how to use of drugs with rational and irrational for the results of the medicines. Slide. Factor that rise to RDU is drug explosions, and then effort for prevent of develop of resistance for antibiotic, and then growing awareness, increased cost of the treatment. It's very important too. And then Consumer Protection Act or CPA. This is a not for not two, yeah. Slide. Circle of increasing use of medicines, rational drug use, including patient and community, and then drug supply system. Ini very important in inventory, and then prescriber, dispenser, and their workplace. Don't forget about legal and regulatory framework. Parliament's number of 72 in 2016. And then slide. Type of irrational use, diagnosisnya, and then prescription, yeah. Dispensing is more important. Start from diagnosis. We can explain, and then we can translate with the prescription doing the doctor or clinical pathway in the hospital, and then in pharmacies can dispensing about that. And then slide. Diagnosis rational use to inadequate examination of patient. Patient is always in complete communication between patient and doctor, and then medical history, laboratory results, or that of name laboratory results, yeah, like HbA1c, and then triglyceride, and then glucose, yeah, and then tension, like that. Slide. This is we can say about irrational use under prescribing, incorrect prescribing, extravagant prescribing, over prescribing, and multiple prescribing. Or in Indonesia, we can say about polypharmacy, and then lower atau dosis yang terlalu rendah, kemudian over prescribing, pola pengobatan yang terlalu bermacam-macam, ya. Kemudian persepan yang tidak benar, artinya ada penyakit, ada keluhan tapi tidak dilakukan, incorrect prescribing. And then slide. Dispensing irrational use complete with incorrect interpretation of the prescription and wrong ingredients, counting, inaccurate counting, compounding or pouring, inadequate labeling. It's so important. More important in counting, compounding or pouring is very important in dispensing irrational use and sanitary procedures. Ya, tetap mengutamakan, or we can also improve up sanitary procedure. Ya, and then packaging. Packaging is always too poor quality packaging. Material is not good. Kemudian and then old packaging size, or which require repacking and appealing package. Repacking so do in hospital. In pharmacy hospital, repacking we can do. And then slide. Hazard of irrational drug. Yeah, hazard of irrational use of drug. We can explain about unsafe treatment, and then prolong of illness, distress and harm to patients, and increase the cost of treatment. Make increase the cost of treatment in patient. Slide. Role of the pharmacist in rational drug use is, slide, prescribing indicators, patient care indicators, facility indicators, drug and therapeutic committee, or we can say KFT, Komite Farmasi Terapi, standard treatment guidelines, panduan-panduan, ya, pedoman-pedoman yang akan kita gunakan, pharmacovigilance, and pharmaceutical care, pelayanan kefarmasian yang harus diberikan kepada pasien, ya. Slide. Use of measure information in 3 general areas relate to rational use of drug in primary care, prescribing practice, latihan bagaimana menuliskan resep yang benar, patient care, about patient, what patient need, facility specific factor, ya. Jadi facility is more important to do with a hospital, to supporting about drug use indicators and make irrational product. And then what is prescribing indicators? One is average number of drug for encounter. So we can average about drug in day by day, we can average the number of drugs and the true percentage of drug prescribed of generic name, and then antibiotic name, and then injection prescribed, and then essential drug or vitamin in our formulary. And then slide. Average consultation time, so we can show to calculation patient start from receipt of prescribing, and then so we can explain until to explain our complication about the drug in patient, and then dispensing time. So this is to calculate again, and then drug actually dispensed, drug adequate label, and product knowledge about the correct dates. This is the right or the correct doses, or underdose, or overdose. This is irrational product of drugs. Slide. don't forget about facility indicator. Yeah, facility indicators is more important about we can do a drugs list of formulary, and then we can serve, we can make the good of product of drugs, and with the dispensing should support our facility indicators. We cannot do anything without the facility in hospital pharmacies. That's very important. And then slide. Therapeutic committee, drug and therapeutic committee. What should the hospital pharmacist so important about therapeutic committee, providing advice on all aspects of drug management, developing drug policy, and evaluating and selecting drug for the formularies. And then guidelines. Guidelines is more important for implementing, and then drug use of identify our problems. Kemudian, and then intervention to improve drug use, and then reaction and medication errors, and drug issue, yeah, drug use issues and policy and decisions. This is more important. And then we can start in drug reaction and medication errors in hospital pharmacy. And then good services, competencies, and administrative support or monitoring and evaluation for success drug use irrational. Slide. This is what should we can important about standard treatment guidelines is for systematically developed statement to help practitioners or prescriber make decision about appropriate treatment for specific clinical condition. Sangat dibutuhkan ya, more important and very need in the hospital with guidelines. Uses of what is guidelines, yeah, providing guidelines to help professionals through the diagnosis and treatment of specific clinical conditions, and orienting new staff about accept norm in treatment, and then justification for prescribing decision made in accordance with guidelines, and quality of prescribing, and then procuring and stocking drugs. It's about inventory of pharmacist hospital, so we not just learn about clinical, but we also to how to manage stocking drugs in warehouse. And then slide. Pharmacovigilance. Pharmacovigilance is relating to collection, detection, assessment, monitoring, and prevention of adverse effect with pharmaceutical products. The four elements of pharmacovigilance case are in identifiable patient, identifiable reporter, suspect drug, and adverse event or DRs. And slides. This is pharmaceutical care. Definition of the mission of the pharmacist is to provide pharmaceutical care. Pharmaceutical care is the direct responsible provision of medication-related care for the purpose of achieving a definite outcome and improve a patient quality of life. So, pharmaceutical care make improve a patient of quality of life. So more important to do in hospital pharmacies. Slide. Okay, this is a reference slide. Thank you for this time about drug of use irrational prescribing, how we can make the irrational for healthy patient, for quality of life patient, and medication errors and therapies. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Any question, please put in the chat room.
Okay, thank you to Ms. Dwi for presenting the material. For the panelist team, Ms. Bunga and Ms. Dila, please leave comments for today's discussion.
Hello, Assalamualaikum warahmatullahi wabarakatuh. My name is Dila from Student Pharmacy in University. Thank you for Miss Dwi Sari for your presentation. I want to ask about this presentation. Miss Dwi, how are you? And can I give my question, Miss Dwi?
Okay. Can your voice is not clear.
Oh, sorry, you can hear me?
Pardon?
As we all know about ethylene glycol information in syrup preparation, according to Miss Dwi, what are the impacts that affect pharmaceutical care in healthy selfish Miss Dwi? This is thank you.
Okay, thank you. I will answer the question of the plural, yeah. So ethylene glycol and the ethylene glycol is today is plural, yeah. Make confuse how to I give my voice is clear.
Clear, Miss.
Yes, clear.
Okay, thank you. This is plural, yeah, plural about ethylene glycol and the ethylene glycol. Mother, you have a child make confused. What should I do with my kids if fever? For this time, we can stop. For this time, we stop about cell syrup and for IDAI was to explain about that, and we can wait. We can wait. Explain for BPOM or ChemCast about this, and then we can for not for a long time. If the communication or warning is from ChemCast, we should have to, and then we can explain the patient about pharmaceutical care. We can explain about this time we cannot to selling or give to patient about syrup, all syrup we stop. I think the patient is should to understand about that and worry yeah, worry the family we have the child maybe worry what should I give to my child with pay for today and then coke and then rainy nose, yeah. The drugs of maybe make a confuse, yeah. We can back to zaman baheula, you know, compounding again, yeah, and then we can counting again, we can meracik lagi gitu ya. What is the I so hard to explain this, and then it's more important is response time is so disturb, sangat mengganggu untuk pelayanan ya, because response time itu membuat KPI or pharmacist hospital itu sangat penting sekali, jadi so important, so very important for pharmacist hospital. So I can answer the question of Dila seperti itu, like that. Okay, maybe Dila enough for my.
Thank you for your answer. It's really clear.
Thank you very much. Another.
Hello.
Hello.
Miss Dwi, I have one question. What do you think about prescribing patent in Indonesia?
Okay, I will read here more, and then. Hello. Hello. I can hear Miss Bunga. What is your question? Is my voice is
Hello.
clear? Hello. I
Hello.
can hear your voice.
I have a... Hello. You can hear? Hello.
I can hear your voice.
Okay. I have one question for you, Miss Dwi.
Okay.
What do you think about prescribing patent in Indonesia? It is rational or not from pharmaceutical perspective? Okay.
Okay. Thank you, Miss Bunga. I will explain about pharmaceutical or irrational pattern in Indonesian. Indonesian prescribing patterns is currently very broad, very broad. So many multi drugs, is so many about underdose, so many overdose. But we can explain to the practice. We can call the practice how to explain that's the prescribing to make this population is underdose or over or upper dose. The clinical so far is except about intervention of pharmacists with evidence base or guidelines. So for these times, our communication pharmacists with practice is not bad. Team of doctor in hospital this time so happy because what is the doing of prescribing, we evaluation and monitoring. So medication error in pharmacies or in a hospital we can handle. So for all in Indonesian pattern of irrational prescribing right now still and we can handle with a good communication between pharmacist and a doctor like that. Miss Bunga.
Okay, nice question, a nice answer.
Okay, thank you very much. Nadiah, so any question?
Maybe for all my friends, does anyone want to ask Miss Dwi? You can ask Miss Dwi if you want.
If no, in no future, we can stop or If no question anymore, we can stop.
Okay, if no question, we can close the event. As we are at the end of the day, let's finish today's event. Thank you to Ms. Dwi who gave today's material, and thank you to the team of panelists who have complete the presentation of the host scientific update material this afternoon. I respect the audience health scientific update material this afternoon. Maybe we can documentation about this if the team documentation can take a picture. Apaan sih? Okay, maybe if have a link option, can send to chat box in the Zoom. Okay, if enough, thank you to Ms. Dwi again who shared very useful material today. Thank you also to the lecturers of the Faculty of Health Science and Technology who were present. Thank you also to the participants who attend today's event. If possible, there is a documentation session. Okay, please. Okay, let's close today's event. See you at the next health update event. See you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much.
Ms. Bunga.